Today is 2025, December 17th. What if your body was sending you small warnings? What if these subtle signals were arriving long before a serious health diagnosis? Many men often miss these early signs of prostate issues. They can seem insignificant or just a normal part of getting older. But some of these seemingly minor changes deserve your full and immediate attention. Prostate cancer can grow silently and slowly for many years. It often does not cause noticeable symptoms in its earliest stages. Finding this cancer early is the most powerful tool you have. Early detection significantly increases the chances for successful treatment and can ultimately help to save lives. The prostate is a small, walnut-sized gland. It is part of the male reproductive system. It sits just below the bladder and in front of the rectum. A very important tube, the urethra, passes directly through the center of the prostate. This tube carries urine from the bladder and semen out of the body. The primary job of the prostate is to produce some of the fluid that makes up semen. This fluid nourishes and protects sperm. Because of its central location, any change in the prostate's size or health can directly impact urination and sexual function. This anatomical fact is why so many early signs are related to these bodily processes. Understanding why the prostate matters is the first step toward proactive health. Even though it is a small gland, its influence on your quality of life can be enormous. When the prostate becomes enlarged, inflamed, or develops cancerous cells, it can put pressure on the urethra. This pressure can lead to a wide range of urinary problems. Many of the earliest and most common signs of a prostate issue involve changes in urination. These symptoms are often dismissed as a natural consequence of aging, but they should not be ignored. A frequent need to urinate, especially during the night, is a classic sign. This condition, known as nocturia, can disrupt sleep and lead to daytime fatigue. If you find yourself waking up 2 or more times per night to use the bathroom, it could be a signal that your prostate is enlarged or has a growth that is irritating the bladder. The bladder may not be emptying completely, leaving residual urine that triggers the urge to go again sooner than normal. Another significant sign to watch for is a weak or slow urine stream. You might notice that it takes longer to empty your bladder than it used to. The flow may not be as strong, and it might even start and stop intermittently. This is often described as a hesitant or interrupted stream. This symptom is a direct result of the urethra being partially blocked. A growing prostate, whether from a benign condition or an early cancer, can physically narrow the passageway for urine. This blockage requires your bladder to exert more force to push the urine out, yet the stream remains weak. It's a subtle change that can develop gradually over months or even years. Trouble starting or stopping urination is also a common complaint. You might stand at the toilet and feel the urge to go, but it takes a few moments of straining before the flow begins. This is called hesitancy. Conversely, after you think you are finished, you might experience post-urination dribbling, where a small amount of urine leaks out. This happens because the bladder muscle has had to work so hard that it struggles to fully empty, and the muscles that control the end of urination are not functioning as efficiently. Finally, a sudden and compelling urgency to urinate can be a very noticeable symptom. This feeling can come on so strongly that you may worry about not making it to the bathroom in time, and it can sometimes result in minor leaks of urine incontinence. This urgency is often caused by the bladder becoming more sensitive and irritable. The constant struggle to push urine past an obstruction can make the bladder muscle overactive. Even a small amount of urine in the bladder can trigger a powerful contraction and a desperate need to go. All of these urinary signs point to a potential physical change in the prostate that warrants a conversation with a doctor. While urinary flow changes are common, some signs are more visually alarming and should prompt an immediate visit to a healthcare professional. One of the most serious warning signs is seeing blood in your urine, a condition known as hematuria. The urine may appear pink, reddish, or even have a brownish cola-like color. The presence of blood can be intermittent, It might appear one day and be gone the next. This does not mean the underlying problem has resolved. Blood in the urine can be caused by kidney stones or a urinary tract infection, but it is also a potential sign of cancer in the prostate, bladder, or kidneys. Similarly, the presence of blood in your semen, known as hematospermia, is another sign that should never be ignored. It is often painless and may only be noticed upon close inspection. The blood may originate from tiny, fragile blood vessels within the prostate or seminal vesicles that have ruptured. While inflammation or infection are common causes, a growing tumor can also cause bleeding by invading or pressing on these delicate structures. Beyond the presence of blood, a noticeable change in the volume of semen produced during ejaculation can also be a subtle clue. This symptom, known as reduced ejaculate volume, can occur if there is a blockage in the ejaculatory ducts, which pass through the prostate gland. This change can be gradual and easy to miss, but it is a piece of the puzzle when considered alongside other symptoms. Pain and pressure in the pelvic area can be an early, though less common, sign of prostate cancer. This is often described not as a sharp, intense pain, but rather as a persistent, dull ache, or a feeling of pressure deep inside the pelvis. You might feel this discomfort in the area between your scrotum and rectum, known as the perineum. Some men report that the feeling gets worse when they are sitting for long periods, during a long drive, or while working at a desk. This pressure can be caused by an enlarging prostate gland pushing against surrounding tissues and nerves within the confined space of the pelvic cavity. Discomfort can also manifest as pain in the lower back, hips, upper thighs. This type of pain is often mistaken for common musculoskeletal issues like arthritis or a pulled muscle. However, if the pain is persistent and not related to any specific injury and does not improve with rest, it could be a sign of a more serious problem. While pain in these areas is more frequently associated with advanced prostate cancer that has spread to the bones, it can occasionally be an earlier symptom in some men. The prostate is located near major nerves that travel to the lower back and legs, and a growing tumor can irritate these nerve pathways. It is important to pay attention to the character of the pain. These are important details to share with your healthcare provider. While many men will experience back pain at some point in their lives for a variety of reasons, pain that is accompanied by any of the urinary or sexual symptoms we have discussed should raise a higher level of concern. Changes in your sexual health can be a sensitive topic, but they can also provide crucial clues about the condition of your prostate. The sudden onset of erectile dysfunction is one such warning sign. This means having new difficulty getting an erection, or maintaining an erection that's firm enough for intercourse. While erectile dysfunction can be caused by many factors, including stress, heart disease, diabetes, it should not be dismissed if it appears without a clear cause. The delicate nerves and blood vessels that control erections run very close to the prostate gland. A tumor can damage those nerves or interfere with blood flow. Another important sign is pain during ejaculation, or pain after ejaculation. This points to a potential issue within the prostate or nearby structures. The pain can be a mild discomfort or a sharp burning sensation. It might make you hesitant to engage in sexual activity. Often this symptom is caused by inflammation, prostatitis. But cancer can also cause inflammation, so it must be evaluated by a professional. Muscular contractions during orgasm can aggravate an irritated or enlarged prostate, causing that painful response. A noticeable decrease in the amount of semen you ejaculate is another subtle sign. A growing tumor can block the ducts that release this fluid during ejaculation. That blockage leads to smaller ejaculate volume. These sexual health changes are medical symptoms, not personal failings. Being open helps your doctor make an accurate diagnosis. While many early signs of prostate cancer are localized to the pelvic region, some more general body-wide symptoms can also appear. One of the most common is persistent and profound fatigue. This is not the ordinary tiredness you feel after a long day or a poor night's sleep. It is a deep, draining exhaustion that does not improve with rest. Cancer cells consume a lot of body's energy. The body's immune system works overtime to fight them. This constant internal battle can leave you feeling chronically weak and worn out. Unexplained weight loss is another significant red flag. Losing even 5% of your body weight over 6 to 12 months without a clear reason is cause for concern. A loss of appetite often goes hand in hand with unexplained weight loss. These general signs, fatigue, weight loss, loss of appetite, are not specific to prostate cancer. Their significance increases when they occur with more specific urinary, sexual, or pelvic symptoms. Knowing your personal risk factors for prostate cancer is a crucial part of proactive health management. The single biggest risk factor is age. The likelihood of developing prostate cancer increases significantly after the age of 50, and about 2/3 of all cases are diagnosed in men aged 65 or older. Another major risk factor is family history. If your father, brother, or son had prostate cancer, your risk is more than doubled. The risk is even higher if multiple first-degree relatives were affected, especially if they were diagnosed under 65. Certain genetic mutations also increase risk: BRCA1, BRCA2. Men of African descent are more likely to develop prostate cancer, be diagnosed younger, have a more aggressive form, and are more than twice as likely to die from it. For these reasons, screening discussions should begin earlier for Black men, often starting at age 40 or 45. A diet high in red meat, high-fat dairy products, and low in fruits and vegetables may increase risk. Obesity is also linked to a higher risk of aggressive prostate cancer. Because early prostate cancer often has no symptoms, screening can be a life-saving tool. Screening tests are designed to find cancer before any signs appear. The two most common screening tests are the PSA blood test and the digital rectal exam. The PSA test is not a definitive cancer test, but rather an indicator that further investigation may be needed. The information presented here is meant to educate and empower, not to cause fear. It is crucial to know when to take the next step and consult a healthcare professional. You should schedule an appointment with your doctor if you notice any persistent changes in your urinary habits, such as frequency, urgency, a weak stream. The presence of blood in your urine or semen, even just once, warrants an immediate medical evaluation. Likewise, any new and unexplained pain in your pelvis, lower back, hips, or the sudden onset of sexual problems should be discussed with your doctor. When you see your doctor, be prepared to have an open and honest conversation. Tell them about all of your symptoms. Inform them about your personal medical history, family medical history, race, and age. It is vital to remember that many men with early-stage prostate cancer experience no symptoms at all. This is one of the most important takeaways. Your body speaks in signals. It's up to you to listen. If this video helped you understand the early signs of prostate cancer, share it, like, subscribe to the Human Blueprint, and turn on notifications. Because prevention starts with knowledge, and health is wealth.